In today's video, I want to answer the question, is massage valuable in the treatment of back pain? Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the treatment and care of people, maybe such as yourself, who also suffer from back pain. The advice I give is a mix of my professional expertise and personal experience, and I really focus on trying to give information that I wish I had known when I was suffering from back pain. So for many, massage can be a very pleasant and pleasurable experience. It can be great for things like relieving stress, promoting relaxation, but is it valuable in the treatment of back pain? So what this video isn't going to be is a deep dive into the most recent research papers focusing on the efficacy or lack thereof of massage in the treatment of lower back pain. Now, of course, that all has great value and can be very useful, but what I aim to give you today is a practical guide on why this treatment option may or may not be valuable for you personally. So in my opinion, massage therapy can be a valuable treatment option for helping to relieve back pain in many, but not all people. So there are various proposed mechanisms by which massage may help a sufferer of lower back pain. One, we've already talked about, it can promote relaxation and relieve stress, which may have a direct impact on symptoms. It can improve circulation, which can aid the recovery, the tissue healing process in an affected area. It can stimulate the release of endorphins, which make us feel better, improve our quality of life, and may have an impact of reducing symptoms, particularly pain. And then, of course, finally, the one that physiotherapists like myself love talking about, the pain gate control theory. This is the theory that non-painful stimuli over a painful area, aka massage, can actually block the pain signals from reaching the brain. So it's a sort of little trick we can play on affected areas which help to reduce the severity of the pain signal being sent to the brain. So various mechanisms by which massage can potentially help with back pain. On a less positive note, it is worth mentioning that, of course, not everyone who has low back pain or low back symptoms will experience relief from massage therapy. And the evidence tells us that even fewer people will experience longer-term relief from that treatment. So even in those who do experience some relief from a massage treatment, it's most likely that that relief won't extend more than a few days post-treatment. And of course, finally, it doesn't happen very often, but a small number of people will experience an adverse reaction to massage, something like muscle spasm that can be quite unpleasant. Another point worth noting is that there are lots of different types of massage, and not all of them are necessarily beneficial or even appropriate for someone with back pain. Also, in my experience, massage therapists are normally pretty good at being diligent and providing health screenings, health questionnaires before offering any treatment to people. However, they generally don't perform assessments to determine what is the best treatment for you and your condition. So if you are a sufferer of some sort of back pain, it's unreasonable to expect them to know how to specifically work around your particular condition and around your symptoms. From my perspective as a physiotherapist, I think of using massage as a means of buying a window of opportunity to then perform other treatments like exercise that are far more likely to have a longer lasting effect. So for example, if I have a patient come into the clinic with a really tight, quite sore lower back, I might spend 15 to 20 minutes of a session performing a bit of massage to help release the musculature, maybe drop the pain threshold a little bit, so then they can use the latter part of that treatment session to perform their rehabilitation exercises that they may have not been able to do had we not performed the massage initially. So my general impression of massage therapy and the way I tend to think of it is that it can form one part of a comprehensive treatment plan that should probably also include physical therapy, rehabilitation exercises, and the necessary lifestyle adjustments that are more likely to have a longer term impact that is going to be beneficial for your condition. and it certainly shouldn't be used solely as a band-aid or a crutch to get you out of acute pain time after time after time. So my final verdict would be that massage can be a valuable part of a back care plan, particularly in two circumstances. Those for whom their back symptoms or their back problem is largely muscular in nature, and those for whom stress is a particularly important exacerbating factor. However, my big caveat would be for those of you who have a history of back pain, which is to say anyone for whom your back pain is more than just an isolated one-off event, you're probably better off getting your massage from a therapist, from a professional who is also trained in those other more medical, more long-term elements of care. So if that's you, your likely best option is to find an osteopath, chiropractor, or physiotherapist who offers massage as part of a complete package of care. So make sure you find a practitioner who does a full assessment of you, knows your condition, and you can use their service safe in the knowledge that they're going to be providing you with a treatment that is appropriate for you and your specific condition. I hope you found that information valuable. Remember, you have the power to take control and move towards a pain-free life. If you enjoyed the video, please give it a thumbs up and consider subscribing to the Back Pain Guide for future videos and more valuable information. If you have any questions or suggestions for future videos, please leave them in the comments below. I'd love to hear your thoughts. Please remember, I'm here to guide and support you in your journey to recovery. Thanks for watching the video. Take care of your back, and I'll see you in the next video.